So I'll start off just giving the update on where things are with COVID-19, and then I'll talk in detail about the 5 to 11 vaccination, which I suspect is a hot topic right now. You've probably been paying attention to where cases have been provincially, and for several days, the province has been up into the 700s in cases. So it should be no surprise that we are continuing to see an incline in cases right now in the province, which I think is perhaps not completely unexpected given we are heading into cooler weather, people are spending more time indoors. We had Halloween, we have US Thanksgiving coming up, we have the big gatherings, and all of that is going to fuel more spread of infection, particularly given the province did take some additional steps to reopen, lifting capacity limits and the like, and that's all created the potential for infection to be spreading more. If we really look across, multiple local public health agencies, and this is the group that I've compared us to for quite a while, you do see it's actually maybe a bit of a mixed pattern. So drawing in all of the different public health agencies here, you can see there's quite a number of us where we've gone up. We're of course the bold green line here. Some of us though maybe are starting to flatten out a little bit, but then you can see Haldimand and Norfolk here, which is really rising quickly. And Haldimand and Norfolk is joining places like Sudbury and others that are having very large growth of cases. And so it's not a uniform pattern, I think, throughout the province right now, but nonetheless, the overall average is that things are going up provincially. I'm not sure why that did that. If we take a look at the case curve here in Niagara, and I sort of alluded to, it does look like we may be at least temporarily plateauing out a little bit. So we'll be watching that trend closely to hopefully see it stays up and maybe even comes down. But we definitely did see an increase over the last few weeks, which we are now hopefully going to be able to maybe recover from a little bit. When it comes to hospitalizations provincially, we are starting to see that increase in cases maybe showing up as a small increase in hospitalizations. The hospitalizations will tend to lag cases going up because, of course, after someone becomes sick, it usually takes a while before they develop severe illness and need to be hospitalized. So we'll be watching that to see if that pattern starts to trend upwards, as we'd probably expect a few weeks after cases have been going up. The ICU numbers still are pretty flat in the province, and ICU numbers tend to go up even later than hospitalizations, as you can kind of see from previous waves as well. In Niagara, with our cases having been up the last little while, you can see that the hospitalization numbers here definitely did go up as well. The ICU numbers, again, are pretty flat. And so when the Ontario Science Table released their latest modeling, which is just a little over a week ago now, they were really seeing that there's a few different possibilities that could play out here. There's a less likely scenario where we're able to flatten it out, but more likely we're going to see cases going up and potentially could see cases going up quite high. And really that's all linked to cooler weather, so people are spending more time indoors. The lifting of the capacity limits the province did in late October, and we're starting to see the fallout of that. And of course, people having more indoor gatherings as we head towards the holiday season. And I think it's really interesting here. You can see that they've actually drawn in the point where the capacity limits were lifted in the province. And you can see soon after that, we start to see the cases go up in the province, showing that that was a likely link to some extent. I've been saying for the last couple of weeks that I think part of what the province needs to do is, of course, they did the right thing by pausing any further lifting of capacity limits or further reopening. But I think we do need to probably take a step back and maybe reinstitute not necessarily all of these capacity limits, but a few targeted ones once again, so that we can bend this curve back into something that's flat or even coming back down, really go back in time to where we were heading previously. Managing COVID going forward, I think, is going to be a combination of course, vaccination, but also having other preventive measures in place. Vaccination, as the Ontario Science Table says here in their including comments, is really critical, but so is having those other measures in place, which I think we've seen with the lifting of capacity limits, partly playing into the increase in cases we're seeing. And they particularly highlight here the experience of Europe and across Canada show that cases can rise very quickly if we are not careful and we don't take action early enough. If we take actually the example of Europe and just take a look at what the recent headlines have been in Europe, there are things like this, where there's a surge of infections and hospitalizations. The World Health Organization is flagging that Europe, which has rushed to reopen lately, and you can see kind of these big crowds that they're having, is now one of actually the only region in the world where COVID-19 deaths are increasing. And that's despite Europe being, of course, a developed part of the world where they had early access to vaccines. But vaccines on their own aren't quite enough to control COVID-19. We need vaccinations, plus some additional measures in society, at least for the next little while, to keep cases under control until we can get more people vaccinated. Of course, these surges in Europe are then translating into more restrictions, more lockdowns. Austria, you may remember, a week and a half ago announced that they were going to have a lockdown of just unvaccinated people, and now they seem to be expanding that lockdown to start to apply more broadly. And that's really a reflection that their cases are skyrocketing, and they sadly now are in a position where they need to take quite drastic action. And I think the lesson for us is to make sure we don't get to this point by making sure we maintain the measures we have in Ontario, which I think are serving us well, but also make sure that we react to the increase in cases right now with small targeted measures, which will stave off getting into a position where we might need to do something more drastic later. And of course, the fallout of taking some of these drastic measures is what we're seeing in Belgium right now, where there actually are some protests in the streets. There have been riots with police. Really, people are not very understanding anymore of the COVID-19 precautions, which makes it very difficult, I think, to take the action that might be needed if we let things get out of control. If we come back and take a look at, in Ontario, just, taking a look at things like mobility, which we know have been tracked with the spread of infections, you can see the mobility is actually maybe slightly decreasing now. That implies that people are spending more time out and about, which is in some sense good, but it's probably also reflecting maybe people are spending more time indoors and maybe having some indoor gatherings. This dark line is the Oxford Stringency Index. It talks about how intense are the COVID precautions that you have in place in your society. And you can see we've been pretty flat for quite a while because we've been pretty flat in our level of reopening. And I think it's interesting if you compare this Stringency Index to what is occurring around the world. So this is, the Stringency Index is shared by Our World in Data. And I'm just going to zoom in here so we can see North America and Europe more closely. And you can see this relatively dark red here means that we have a higher level of stringency. We have more intense COVID precautions. You can see south of our border in the US, they're a lighter color, so they don't have nearly the same intensity. But when you start looking over at Europe, you can see Belgium here, you can see Belgium here, you can see Switzerland, Austria, all countries that are lighter than us, which is partly why they're seeing the increases. One of the headlines I showed Germany as well. Again, more increases of cases. And Denmark, Norway are other countries that are seeing quite large increases in cases. Again, you can see light colors, implying that they don't have the same level of COVID precautions that we have in place in Canada, which is partly why we, coupled with our slightly higher vaccination rate in Europe, means we're not seeing the big sharp increases that Europe is. But of course, we want to make sure we maintain that and hopefully get cases back a level or even going down so that we don't end up in a similar situation a few months from now. Taking a deep dive into what is driving our cases up, I think we've talked about it being the pandemic of the unvaccinated, and the orange line here represents unvaccinated people. The navy line here are vaccinated people. And you can see infections, the risk of infection is much higher in unvaccinated people. And you can see the increase lately is pretty much all unvaccinated people. Yes, there has been a small increase in vaccinated people, but the degree of increase if cases growing is much greater in unvaccinated people. And likewise, when we look at hospitalizations, that is entirely the unvaccinated people where hospitalizations are going up. You're not really seeing much of any increase here in terms of fully vaccinated people. And when it comes to ICU admissions, you can see this is almost at zero. People who are fully vaccinated aren't ending up in the ICU. People who are unvaccinated are the ones ending up in the ICU. And so the vaccine remains really important for us to manage the spread of COVID-19 going forward. If we take a look here in Niagara, where our infections are spreading amongst age groups, this is a story I've been speaking for the last couple of weeks, that if we look at our under 12 age group, which is of course an age group who cannot be vaccinated, so they are all unvaccinated, we see by far the most spread lately occurring in that age group, where there's a much more clustering of all the other age groups where the vaccine uptake has been, well, they've actually been eligible to have vaccines. So of course there has been vaccine uptake. I also note that this dark blue line is the next highest one, which is of course our next highest rate of vaccination. It's the most vaccinated groups, the 60-year-olds, 70-year-olds, they're farther lower down than the less vaccinated, and of course the unvaccinated children are where we're seeing the most spread of infection. And if we break that down even further, you can see it's particularly the school-age children, 6 to 11, where we're seeing the most spread of infection. And of course that ties into what we'll talk about in a moment, which is of course we can now vaccinate this group. And that is hopefully going to mean that we stop an end to that increase, which actually would mean that we might no longer be seeing cases quite as high in our community, given how much this group is contributing to spread of infections, both by directly getting sick, but also by then spreading infection to some of these other age groups. If you look at where our outbreaks have been occurring, over the last month in Niagara, it's of course notable that almost 40% of our outbreaks have been here in the education sector. Again, I think reflecting that we have a big pool of unvaccinated children who just cannot be vaccinated, and that's allowing infection to spread and unfortunately these outbreaks to occur. And there's real costs, I think, to our children when they're experiencing those outbreaks. If we look across Niagara, we've had, at least as of middle of last week, 304 cases linked to school. That is either they got infected at school or they're infected outside of school, but they brought infection into the school, exposing others to at risk. That's been 18% of our cases total in the community have been cases that are in this population who are attending school. There's been well over 5,000 children who have been contacts of a case of COVID-19 in school. So these children, by virtue of attending school, when there's someone else infected with COVID-19, have all been put at risk of COVID-19, showing that there's a lot of risk sometimes when there's someone who's infected with infection showing up in school. And of course, that's partly what the vaccine will hopefully be able to protect people from. Close to 100 schools have been impacted with COVID-19, and we've had 27 outbreaks. And just diving directly now into looking at that under 12 age group, the age group who cannot be vaccinated, you can see 2/3 of our cases linked to school have actually been in that age group. And close to 2,800 contacts have been in that age group. And what's significant is because these contacts all cannot be vaccinated, when they are contacted with a case in school, that means they are staying home, they are isolating. Probably given their age, a parent is also having to stay home from work to take care of them. They're missing school, their parents' life is disrupted. There's real costs to these infections spreading in school in terms of the disruption to students and families that's occurring. And that's something that hopefully the vaccine will allow us to be able to prevent going forward. And you can see when we look at what kinds of schools are the infection spreading, it's overwhelmingly elementary school, which again fits, I think, directly with that being the population that cannot yet be vaccinated. So that's where we're seeing the most cases. There's some good news when we're looking at our vaccine uptake overall in Niagara. This data is unfortunately a week old. I didn't have a chance to update it, but of course we are past 75% of our population is fully vaccinated, and we're actually getting pretty close to, I think we're at about 74.1% today of this childhood age group of 12 to 17, and I'm hoping we can soon get them to 75% as well. So 75% of our 12 to 17-year-old age children will be fully vaccinated going forward. But you can see we've got pretty good uptake across most age groups. There's a little bit more we need to do with our younger age groups to get their vaccination rate up higher. But soon I think we're going to be focusing on that next group that will fit in here, which will be the 5 to 11 age group. I talked a little bit about how schools and the disruption occurring to students attending school is, I think, one reason why we want to get that population vaccinated. Of course, we're also seeing the greatest risk of infection amongst that group. So there's definitely, I think, very good reasons for vaccinating them. But I also want to highlight that severe illness is something that sadly does afflict this group. This is the national and provincial data, and unfortunately, they don't break it down any smaller than a 0 to 19 age group. But when we look at that 0 to 19 age group with COVID-19, we can see that there's been close to 2,000 children who've been hospitalized with COVID-19 in Canada. We've had 241 ICU admissions in Canada, and sadly, 17 children have died of COVID-19 in Canada, 6 of whom have been in Ontario. And while that age group is, looking at the full 0 to 19 age group, We do know some of those deaths have been in younger children. This was a headline about 5 or 6 weeks ago coming out of Waterloo region of a child who was under the age of 10 who sadly passed away of COVID-19. And obviously, we want to prevent seeing these headlines and prevent any family to have to undergo this, which is, I think, another reason why we want to vaccinate children. While severe illness isn't as common in young children, it sadly does occur, and the vaccine hopefully can prevent those from being the kinds of headlines we have to see and the kind of anguish any family has to go through. I just want to highlight how the COVID-19 vaccine for 5 to 11 years really compares to other diseases where we are vaccinating. So if we take a look here at hepatitis A, chickenpox, and influenza, all diseases where we have a vaccine, and we're going to look at years before the vaccine was available, and this is in the United States. This isn't Canadian data, but I think it's going to be broadly similar. We can see how often children are hospitalized with each of these diseases, which we now vaccinate for to prevent, as well as how often children are hospitalized for COVID-19. And you can see the rate that children are being hospitalized for COVID-19 in the US is very similar to the rate that they're hospitalized for chickenpox and pretty close to the rate that they're being hospitalized for influenza. And we, of course, deliver chickenpox vaccine to every child. They get it at 15 months of age and then again at 4 years of age. Influenza, we, of course, recommend to all children, and that's partly because of these hospitalizations we want to prevent. And of course, if we're preventing these hospitalizations with the vaccine, it looks like COVID-19 fits into that same group where its burden of hospitalizations is high enough that we would similarly want to be doing the same thing we do with these two infections and vaccinating against this to prevent those hospitalizations. When we look at deaths then here, we can again see what is the incidence of deaths in the United States, an average number of deaths per year from COVID-19. And then looking across at all of these other vaccine preventable diseases and how frequent deaths were before vaccines were rolled out for them. Hepatitis A, we of course don't routinely vaccinate for, but meningococcal vaccine is one of those grade 7 vaccines we deliver in schools. Chickenpox, we just talked about, 15 months and 4 years of age, you get that vaccine. Rubella is part of the MMR vaccine, so children get it at 12 months of age and then again at 4 years of age. And then the rotavirus vaccine is recommended in the first 6 months of life for every child. And you can see, all of these diseases are less deadly, even though we've started to vaccinate against them to prevent those deaths. COVID-19 is by far the most deadly of these infections. And if we're vaccinating to prevent deaths for these infections, we want to be vaccinating for COVID-19 to prevent deaths for those. And in the United States, where sadly they have not done a good job of controlling the spread of COVID-19, you can see COVID-19 deaths in children 5 to 11 actually slots in as tied with being the number 8 cause of death for children age 5 to 11 in the United States. And so, unlike some of these other ones, this is something that we can easily prevent with a vaccine, which I think makes it a really good argument for everyone to make sure they get their children vaccinated so we can prevent these really preventable deaths and make sure that COVID-19 never becomes one of the top 10 causes of death for children in Canada in this age group. The good news about our vaccine, I think everybody wants to know is how good is it? It is very good. This 90.7% effectiveness is pretty similar to the effectiveness that we see for adults getting that vaccine. But I think the really good news is that not only is this vaccine effective, this vaccine is actually very safe. And I'm just going to show the slide. This is a bit of a busy slide. It comes from the US CDC, but it's looking at the different side effects that someone might have after COVID-19 vaccine here. And it's looking at this, which is in age 5 to 11 children, and then people age 16 to 25, and what was the difference in side effects you had. And if you're looking at a placebo here, you can see, there's no real difference between the 5 to 11 children and the older people when they get a placebo because they're basically getting the same thing, so there'd be no difference. When we look at the vaccine here, though, you can see age 5 to 11, less likely to get a fever, maybe about 1/3 about as frequently they're going to get a fever than older children and young adults. Fatigue is going to be less common as well. Headaches are less common in that 5 to 11 age group after vaccination. Chills are less common for that 5 to 11 age group after vaccination. Vomiting is slightly less. Diarrhea is less. Muscle pain is much less. Joint pain is much less. Across the board here, we can see that actually children are much less likely to actually get side effects from the vaccine than were older age groups. And I think that's really good news, that children are not only getting a really effective vaccine, they're actually going to be getting a vaccine that's slightly safer than the rest of us got. And all of the experiences that we had with vaccine where we got the protection and maybe we had to suffer through some chills or some fever, children are going to actually have an even better experience with a vaccine, get an even safer vaccine, but still get all of that protection. Even when we look at something like here, where this is set up a little bit differently, but pain at the site of injection, lots of children 5 to 11 got pain at the site of injection, but actually people who are age 16 to 25 were even more likely to get pain after that injection. So even with the pain that you suffer from the vaccination, it's less with the COVID-19 vaccine in that age 5 to 11 group, which I think is really excellent news for all of them. As we roll out vaccinations for this group, we're heading to, I think, another season where it's going to be a busy period of vaccinating. So right now we have another 45,000 or so people who are eligible for vaccination in Niagara who are not yet fully vaccinated, people who still need to, for the most part, get even their first dose, but a few who've gotten their first dose and need a second dose. So we're still trying to work to make sure we vaccinate that group. A bunch of people have recently become eligible for booster doses in the 25 to 45,000 age group, and that's actually the biggest group we're seeing coming to our clinics right now. We're about to add 32,500 children into the group who need to be vaccinated, and we have a big influx of older adults, age 70 and up, who are soon to become eligible for their booster doses as well. And so you can see there's a lot of people who are soon going to be eligible for vaccinations, and there's going to be a lot of vaccines going to be done. Given all of these people being vaccinated, we are trying to prioritize in public health who we're going to vaccinate. And so what we have decided is that, of course, all of these other age groups, the older age groups, they've already had an opportunity to get their first and second dose. Many of them here, these group and these group, actually already have that first and second dose, and so they have really good protection already. They're just getting a booster dose to top it up and make sure that they don't see any waning going forward. The age 5 to 11 have not had any opportunity to be vaccinated yet. And right now we're seeing the highest risk of COVID-19. The greatest amount of spread of COVID-19 is happening in this age group. And so we've decided this is going to be our top priority as soon as we get vaccine, hopefully sometime within the next week. And we are going to be delivering clinics targeted just to this age group for a period of time, to make sure we give them the opportunity to get their first dose as quickly as possible. And our expectation is we should be able to vaccinate them all with their first dose before the Christmas holidays so that they have protection going into the Christmas gatherings going forward. Once we have delivered vaccines to this group and we're seeing a slowdown, at that point, we'll start to reopen vaccinations to some of these other age groups to give them their top up of vaccine with boosters, continue to try to get to those first and second dose people who haven't yet chosen to get vaccinated to hopefully get them vaccinated. But for the next little while, you can expect that vaccine clinics are really going to become exclusively for the 5 to 11 age group as we make sure we get them the opportunity to get vaccinated as quickly as possible and make sure this group who doesn't yet have any protection gets that opportunity to get protection going forward. With that, I will stop and I'll turn it over to Courtney to moderate the questions.
Great, thank you, Dr. Hergy. Okay, to start, we have Dawn, and you should be able to unmute now.
Thanks for taking my question, Dr. Hirji. I guess you kind of answered some of my questions when we were talking about vaccinations for age under 12, and of course, the latest. And yeah, I just wonder if you can give me a little more on that and how the rollout is going to be in Niagara.
Yeah, so we're anxiously waiting to see what date we're going to receive vaccine. We heard the province is going to be opening up their booking portal for tomorrow, so we're hoping to at least get some clinics in, so we have some places for people to start booking as of 8 a.m. tomorrow. Vaccine is really going to be delivered in 3 channels. We in public health will probably be the largest channel. We're going to be holding clinics across the region, clinics that we're going to make child-friendly, to make sure we get lots of opportunities for people to register for appointments and come in to get their vaccine. A second channel is going to be primary care. Most actually parents are used to taking their child into their primary care provider to get their vaccinations in childhood. Primary care providers are the trusted source, I think, for delivering vaccines, and we think a lot of parents are actually going to want their children vaccinated in primary care. And so we, are going to see primary care taking on a big load of vaccinating children as well. And then finally, of course, we'll have pharmacies available as well to do vaccination. And pharmacies, of course, are very plentiful. Every neighborhood in Niagara has it. So hopefully everyone will be able to have an easy access to an appointment through them if that's their choice. And so those will be our three principal channels: public health clinics, primary care, pharmacies. Working together, we've done the math, and we should have no problem making sure every child 5 to 11 has an opportunity to get an appointment and get a vaccine before the Christmas holidays this year, so they can get that protection. The clinics we run, as I mentioned, in public health at least, are going to be child friendly. We're going to have a more welcoming environment for children, lots of distractions for them, to try and make it a really positive experience, so that they don't feel like they don't want to come back and get that second dose a few months from now, or a couple of months from now.
That's great. That's all my questions. Thank you very much.
Great, thank you. Okay, up next we have Ludwig, and you should be able to unmute now.
I don't have any questions this morning. Thank you.
Okay, thank you. Up next we have Paul, and you should be able to unmute now. Paul, if you're speaking, we can't hear you. Still aren't able to hear you. We'll give you a second to maybe try and figure that out and move down to the next person on the list. And it's Gordon. You should be able to unmute now.
Hi, thanks. I just wondered, do you know exactly yet how many doses you're going to get and when they will arrive in Niagara?
We don't know how many doses we don't know what date the doses are going to arrive. We understand it will probably be actually maybe sometime later this week, which should be really good news about getting vaccine clinics up soon. So we're hoping to get some clarity on that sometime today, so that we're able to get some clinics up into the portal for tomorrow morning. Otherwise, we at least have some clinics up there, and then if we find out we get vaccine a bit earlier, we can then later add some additional clinics even earlier than what we've planned. In terms of the number of doses we're expecting, it looks like between public health, pharmacy, and primary care, it's going to be close to about 20,000 doses initially, with opportunity to order more doses as we need it. As I mentioned, we have about 32,500 children who are eligible for vaccination. So, hopefully we'll get through that 20,000, and we'll have many more parents bringing their children in, and we'll be bringing in more doses as well. From what we understand, the Canadian government is receiving enough doses for every single child 5 to 11 in Canada to get a dose. So there should be no problem making sure we have vaccine for every child. It's just going to be a matter of people making the choice to bring their child in for vaccination.
And a follow-up?
Sorry if this sounds like a two-part question, but it's not really. Sorry, just to clarify, did you say there will be more clinics online by tomorrow? But also I'm wondering, in the past, you've mentioned that there's been some drop off in the number of staff and volunteers available for the clinics just because of the amount of time it's been going on. Do you have enough staff, and do you need more volunteers for these?
So we're not adding more clinics necessarily tomorrow. We have clinics in the system right now up to November 27th, I believe. We held off putting clinics past that date, given that we wanted to see when the vaccine for children would be approved so we could load clinics up. So what we'll have up tomorrow would be clinics for children to book into appointments. Those will probably be from the 28th onwards, but could be earlier depending on when we see the vaccine will actually arrive here in Niagara. In the second part of the question, sorry, I forgot what that was now.
As to whether you have enough staff and volunteers.
Oh, right, yes, if we have enough staff. It's kind of like a budget for an organization. If you have more money, you can always do more, and we'd always love to have more. We have enough staff that we're going to be able to deliver vaccines and get every child vaccinated before the Christmas holidays, if they choose to come. So we have enough staff to do that at least.
Okay, I see Paul is still unmuted. Are we able to hear you now, Paul? No, okay. We will move on then to Penny, and you should be able to unmute now.
Hi, thanks. So I'm a little bit confused, and I'm sorry if I misunderstood you, but you talked first about prioritizing the children's age group, and then I thought you used the word exclusive. for children's appointments. So would there be any opportunity for some of those other age groups who have had the opportunity but aren't vaccinated, or they will just have to wait until all children are vaccinated, or until after Christmas, or what can you explain that to me?
Sure. So we are going to prioritize our clinics for age 5 to 11. So they will really just be for age 5 to 11, nobody else for a period of time. That's not necessarily going to be all the way to Christmas or past that. You know, we're not expecting every single child 5 to 11 will come forward to be vaccinated. But for the initial rush, we want to make sure we have prioritized our capacity for them. Once we start to see it's slowing down in terms of appointments in the age 5 to 11, we'll start to open our clinics up to other age groups to make sure that we are giving, opportunities for everybody to get the vaccine. But for the period of time when we first get vaccines for age 5 to 11, because that age group hasn't had any opportunity to be vaccinated yet, and because we're seeing the highest risk of spread in that age group, we really want to go all in and prioritize making sure we can vaccinate them as quickly as possible.
Would that mean if there are people in the community who are either eligible for a third dose or are make the decision that they want to get their first or second dose? I understand it's a different vaccine. Would they still be able to maybe go to a pharmacy or go to their primary caregivers? In other words, are there doses for adults available in the region?
Yeah, yes, there will be. Many pharmacies will continue to vaccinate anybody who comes in. Primary care, different providers may choose to do that as well. What I'm speaking for is really just the public health clinics.
Okay, thank you very much.
Thank you. Okay, moving on. Next we have Nicole. You should be able to unmute now.
Excellent. Thank you so much, Dr. Hirji. You were mentioning even today, and also you were quoted last week too, saying that we may need to take a step back and look at the restrictions in order to prevent further spread. Would you suggest moving forward, if cases do start to climb even more, that you as Niagara's Acting Medical Officer of Health would impose restrictions? And what would they be?
Yeah, I wouldn't necessarily want to frame it as taking a step back. I think I would frame it more as we want to refine the stage of reopening that we're at. We're not necessarily going to roll back everything that just happened, but take stock of where we're seeing the spread in the region, and I think in the province as a whole, and just tweak our capacity limits and the like to make sure that we get the cases back under control and we don't start heading in the trajectory of a place like Europe, for example. I really think that since cases are rising province-wide, that really the action should be taken by the province. Obviously is always open to taking action locally. We've done that a few times where we've seen local spread and the province has been addressing it. So I'm not ruling that out, but I really think the onus should be first on the province to do it because the cases are rising province-wide. It's not just a Niagara problem.
And a follow-up?
Yes, thank you. Just touching a little bit more on vaccines for children, when you were showing some of the numbers, they appeared lower, obviously, for kids and teens that are currently eligible. Will there be any incentives to bring your child to get vaccinated for the 5 to 11 group or even the 12 and up, who seems to be a little bit lagging behind the other groups in Niagara?
Could you elaborate what you mean by incentives?
So other states, for example, let's just say they might give out gift cards, have a more interactive experience if you bring your child, anything monetary, incentives. I'm not sure if that's something Niagara would look into. Yeah,
so I'd say if, something like a monetary incentive, a gift card, that kind of thing is probably not something that we're going to be looking at in the near future. I wouldn't rule it out for down the road, but I don't think that we would be thinking about that per se. There is an opportunity for maybe a small trinket, a small toy, a little coloring book or something when children come to our child-friendly clinics that might be something that they can walk away from, particularly if we are handing that out as something to keep them distracted from focusing on that needle that's about to go in their arm. That might be the kind of thing we're doing, but I would see that there's less as an incentive, and the reason you're coming for the vaccine is more just a little, positive thing that you get to take away from it. I really believe that, most parents aren't going to make a decision about vaccinating their child based on an incentive. I think there's really strong arguments for them to vaccinate their child just to protect themselves, given that their children right now are at high risk of getting COVID-19. They're seeing the disruption of school, having to be sent home when there's a case in school. themselves maybe having to stay home to take care of the child. Seeing some of the data I showed, in terms of hospitalizations and deaths and the risk of children, I really feel that is probably going to be enough reason for parents to get their child vaccinated. The reason parents might not be getting their child vaccinated may be because of some of the misinformation they're hearing and some ongoing concern about safety. And I think that's probably where we're going to have more effect in terms of convincing parents to get their child vaccinated than necessarily giving out incentives. But I'm not ruling that out as something that we might not, we might do down the road.
Okay, thank you. Up next, we have Evan, and you should be able to unmute now.
Perfect. Hey, everybody. Dr. Hergy, thanks for the great update. My main question was asked, but I'm wondering, can a parent take their child to get a Pfizer vaccine that's available now, or should people wait for the child-specific doses, and why?
So parents, if their child is younger than 12 years of age, absolutely should be waiting for that new childhood formulation of the vaccine. The vaccine that we all receive that's eligible, 12-year-olds and up are eligible for, is not licensed in Canada for anybody younger than the age of 12. So you'd be giving a vaccine that is not licensed. And I don't think there's really any healthcare provider who would choose to give that vaccine when it's not licensed. We take the safety of vaccines really seriously, and we wouldn't want to give that vaccine that's not licensed to children. As well, we're talking a number of days here before we have the vaccine for children. I imagine within a week, we are probably going to have that vaccine. So waiting a few days until that vaccine's available, I don't think is really a reason you would want to rush ahead and take a vaccine that's not licensed when there's the opportunity to get the vaccine that is licensed, that's gone through the thorough safety review, where we know it is definitely safe for the age 5 to 11s.
And a follow-up?
Yes, perfect. Very good. Thanks for the answer. And so you're saying first doses, hopefully for all kids in the Niagara region by Christmas. And I'm assuming, and my question kind of is the same time frame applying to kids in terms of waiting a month or so to get a second dose?
So the recommendation by the National Advisory Committee on Immunization is actually now that the first and second dose, and this is for children, but actually even for adults as well, should be 8 weeks apart. What we've seen is that when you vaccinate people 8 weeks apart or longer, we actually end up with better immunity, and we end up with immunity that doesn't wane over time. And so that is the recommended interval. So, the first round of vaccines will get out to children before Christmas. 8 weeks after that, we'll be doing the second round of injections, vaccinations for children. And in between there, there'll be the opportunity, of course, for all those groups who are eligible for booster doses to come in and get those booster doses.
Great. Thanks. That's all for me. Have a good day, everybody.
Great, thank you. So Paul has sent through his questions in the chat due to audio issues. So Dr. Hergy, do you expect much vaccination hesitancy from parents? And do you hope the majority of families will opt to get their kids vaccinated before Christmas?
Yeah, so on the second part, I do expect the majority of parents are going to choose to get their children vaccinated before Christmas. When we look at the polling out there that's been done amongst parents, we're talking on the order of 60 to 65% of parents want to get their child vaccinated. So that's close to 2/3 of parents. We also see that with the 12 to 17-year-olds, we're just under 75% of them being fully vaccinated. And we're actually close to, I think, about 77% or so of them have gotten at least one dose. So, most parents have chosen eventually to get their older children vaccinated, and I think they're going to make that same decision for younger children. So I do expect that we'll get a majority of children fully, so at least vaccinated with that first dose before Christmas. In terms of hesitancy, I do think there is a reasonable amount of hesitancy. The reason we're only at, just under 75% of children 12 to 17 fully vaccinated and not higher is, I think, because of some hesitancy out there. Some of that, I think, is due to parents, really making, holding the safety of their children really carefully and wanting to be sure that the vaccine is safe for them. And I think there's more we can do to get the message out and help them understand that. I think the presence of misinformation on the internet is, of course, making it more difficult for some parents to really understand what the truth around these vaccines are. And I think we need to keep doing work to make sure we get that message through them around the safety of vaccination. The other part is that I think there are some parents who actually have barriers to getting their child to a vaccine clinic. They live in a neighborhood where there's maybe not pharmacies nearby. They may be parents who are working 2 jobs, multiple shifts. They don't have time to actually, during normal hours, get their child to a vaccine clinic. Maybe they don't actually have a means of transportation, so getting there to a vaccine clinic is difficult. We need to keep doing work to try and engage those parents and help break down the barriers to them getting vaccinated. One of the things, of course, we've been doing has been our pop-up clinics, making sure we get around to different parts of Niagara and particularly targeting pockets of Niagara where vaccine uptake has been less, to make sure we're breaking down that geographic barrier and making it as easy as possible for people to be vaccinated. And we're going to continue working with partners and others to hopefully help them get the access to the vaccine so that we can get their vaccination numbers up as well.
Great, thank you. So we've gone through the list once. If anybody has any follow-up questions, if you can let me know in the chat. And I see Nicole has already mentioned that she has another question. You should be able to unmute now.
Thank you so much. Dr. Hirji, just following up on the restrictions part, what specific establishments or events would you encourage the province to look at when it comes to capacity limits?
Yeah, a big one that I would be looking at would be sports and recreational athletic facilities. We've actually already seen, I think, on the order of about 24 out of 34 local public health agencies bring in some fashion of local rules around that. We have definitely seen outbreaks linked to those facilities. And I can say over the last few weeks, we've seen more outbreaks after the capacity limits were lifted in those settings. I do think that is an area where there is some higher risk. And I think some really tailored actions there could actually help. I don't necessarily think we need to bring back the full capacity limits, but bringing back some limits to limit the social interaction of people before and after games, maybe bringing some capacity limits into change rooms so you don't have a change room full of people after a game where they're all breathing heavily. Aerosol from anybody who might be infected is building up and you're creating that high risk environment for everybody to become infected. That's an example of the kind of thing that I think that they should be looked at. And I think the province should be looking at the data province-wide to see, are there any other patterns that we're seeing in terms of infection spreading, and making sure we do some really targeted, tailored action to address those.
Great, thank you. Not seeing any more questions in the chat. We will end things there. Thanks everybody for coming. And again, just a reminder, our next media briefing will be on December 20th. So we'll see you then. Bye.